And now a Republican response to the president's remarks in Boston today, strongly defending Obamacare. And Republican Representative Michelle Bachmann of Minnesota is joining us here in the Situation Room. Congresswoman, thanks for coming in.
Thank you.
You heard the president today, earlier in the day. I want you to listen to one line that he said, because he might have been referring to you and some other Republicans.
And anyone defending the remnants of the old broken system as if it was working for people, anybody who thinks we shouldn't finish the job of making the healthcare system work for everybody, especially when these folks offer no plan for the uninsured or the underinsured or folks who lose their insurance each year, those folks should have to explain themselves.
All right, go ahead and explain yourself.
Well, it's another false statement that the president says.
What's false?
He assumes that anyone who is not happy with the current program is somehow 100% defending what we had before. That isn't true at all. We had a whole passel of reforms that we wanted in the health care system. The president wasn't interested. He only wanted the federal government to completely subsume all of health care and then force every American, whether they liked it or not, into his version of health care. And it was really interesting, Wolf. The way the president opened his speech was to praise Mitt Romney for working with Republicans and Democrats in Massachusetts. And that's what's so bizarre. The president didn't work with one Republican on this massive takeover.
He tried, but the Republicans didn't want to work with him.
He didn't.
They didn't like his ideas.
He didn't get one Republican vote.
I know he didn't get any votes.
What does that say? That tells you the president had one idea for health care, which is the government ownership, government control, and government mandate. Right. We don't want forced programs. We want choice in programs and freedom for people.
So this is the law right now, the Affordable Care Act. It is the law. Do you want to try to make it better, to fix it, or do you just want to destroy it?
No, what I want is the finest possible health care for America that we can have. We did have fabulous health care, and I think we can again.
Well, a lot of people didn't have fabulous health care. There were millions of people who had no health care.
Well, remember what the president's talking about right now is fantasy health care. He promised all Americans that you and I would be saving $2,500 a year. Didn't happen. It's not going to happen. He promised us no tax increases. Huge tax increases. In fact, the biggest middle-class tax increase we've ever seen. He told us that if we liked our health insurance plan, we could keep it. Tell that to 16 million Americans today. Or that the cost was actually going to go down. That didn't happen to Jason Anderson in my district, who's 31 years old, who he and his wife and his 2-year-old baby saw their premium double and their deductible triple.
What about all those people who now can buy health insurance because they had a pre-existing condition? And earlier they couldn't buy health insurance. All of a sudden now they can go out there and buy health insurance. You would welcome that. That
was the heartbreaker for every American to hear those stories. That's something where Republicans and Democrats could have come together. The Washington Post said this is a $5 billion problem. You know me, Wolf, I'm a strong fiscal conservative. I would have gone to the Treasury and stroke out the check for $5 billion every year to pay for the pre-existing pool. That's something we could take care of, but we don't have to force over 300 million Americans to buy a health insurance policy at a price they can't afford from a website that doesn't work. That's what we don't need in health care.
Well, presumably that website will work one of these days, sooner rather than later, right?
The website, at some point, I think will work. If it doesn't, it'll be the laughingstock of America. But the bigger problem in all of this is a health care system that won't work. Because, again, what I would say to the president is, what are the Democrat senators, the Democrat House members who voted for Obamacare, what are you going to do about the millions of jobs that have been lost because health insurance premiums have jacked people up so high they can't afford to buy the health insurance? What are you going to do about Jason Anderson in my district who saw his premium double? What are you going to do about the woman who for 37 years has paid for the family policy? This year, again, her premium will go up $2,000 a year, and her deductible will triple.
But I think you agree, for all of those stories, there are a lot of other stories, heartbreaking stories as well, where people who had no health insurance, now for the first time in their lives, they do have health insurance.
Even the government says when all is said and done and the government takes over health insurance, 30 million Americans will still be without health insurance.
That's better than, better than 50 million.
We weren't at 50, but that's including.
We were pretty close.
That's also including illegal aliens. And if you ask Americans, they don't believe that it's the job of the taxpayer to pay for the health insurance subsidy for illegal aliens.
On this new Gallup poll that is just out, do you approve or disapprove of the health care law? It's actually improved a little bit. August, 41% approved. Now it's up to 44%. So there's a slight improvement. People are beginning to like it a little bit more.
Well, not in my district they aren't. People are really upset about it. But again, remember, your viewers, their tax money has been used to spend on tens of millions of dollars of advertising to tell America, you love it, you really love it, you know you love this. So we're being forced by our own tax money to be told that we love this plan. I will tell you, not at home. Not at home they don't. People love things where somebody else buys their product for them. But again, think of what we're talking about here. Every American is forced to buy a product, whether they want to or not, at a price most of them can't afford unless the government subsidizes it. And again, what we believe is that it should be voluntary. If there are people without health insurance, we get that. But make it voluntary. Don't force us to buy something that we don't want to buy.
We will continue this conversation.
Very good.
Michelle Bachmann, thanks for coming in.
Thank you, Will.